For Action News, I'm Anna Dolosky. The debate continues about how to manage a serious and rapidly growing problem in the U.S., opiate addiction. One solution out there, strict guidance and regulations about prescribing narcotics to cut down the number of addicts and the number of deaths. The position is outlined in a recent paper in JAMA, and it stresses the FDA is working to develop a non-opioid pain medication intended to treat severe pain without the addiction potential. Sounds pretty reasonable, except there is one glaring misconception. ACTRA's Dr. Josh Bloom says these wonder drugs simply aren't in the making.
Well, it's really easy for people who aren't in agonizing pain to write puritanical statements about those who are. And there's one quote that really infuriates me, and it's the development of non-opioid pain medications intended to treat chronic musculoskeletal and neuropathic pain. These are what are needed. So this is their solution to getting rid of or cutting back on opiates. Well, guess what? There aren't any. And I took a look at the clinical trials, which you can find at clinicaltrial.gov, and just put in severe pain, and there are hundreds and hundreds of clinical trials. I went through a bunch of them, and I don't even think I found a single new drug. It was simply combinations of old drugs given in different ways. They seem to be proposing that you cut way back on opiate prescriptions and wait 10 years for a magical drug to somehow appear, which might even not appear ever. So, yeah, that's easy to say when you're not in pain, but I just think this is some break from reality. They don't understand that they're unlikely to be safe drugs for severe pain anytime soon.
Let's look at some attempts to deter narcotic abuse. Back in 2010, Purdue Pharma developed an abuse-proof formulation of OxyContin, one of the most abused drugs by far, where grinding the pill turned to a gummy substance, virtually useless to addicts. But that didn't stop the quest for a different high.
It was approved in 2010 by the FDA. It hit the market in August of 2010. There's a little lag period where it's being used up, and right after there you can see what happens. OxyContin use within a year and a half essentially drops in half, and heroin use goes up 4 times. So deaths from heroin went skyrocketing, and you can take a look at the graph where the red arrow is, and that's August 2010, and it's not subtle what was going on. You had more than a doubling of heroin deaths, and this is just in New York City. And you can also look on the graph, and you can see that the other opiates, which would be Vicodin and oxycodone, they did nothing. So this policy, all it did was switch people from legal prescriptions to heroin.
Another group, the Physicians for Responsible Opioid Prescribing, suggest self-help, counseling, and low-dose analgesics to treat real pain. Not good enough, says Dr. Bloom.
I was doing a little reading on what their suggestions are, and this is probably even worse. Now, their intent, I suspect, is good. That's to prevent some of the huge numbers of addicted people in the United States. But if you look at what they are suggesting to do about it, it's laughable. For instance, they want you to get self-help and counseling. That's just wonderful if you've got 24-hour-a-day spinal pain or terminal cancer pain. That's going to really help. You might as well hit yourself over the head with a bowling ball while you're at it. And, of course, then they add low-risk analgesics, such as gabapentin, which is also called Neurontin. You could take all the Neurontin in North America, and it's not going to touch severe pain. It doesn't work that well. And they want to throw in antidepressants. For severe kind of pain that narcotics are needed for, they're not going to do anything.
Dr. Bloom says those who abuse the drugs are both old users and new, those who get hooked on the drugs after having them prescribed for severe pain. So adequate counseling by doctors is key, but so is cracking down on criminal activity.
Depriving patients of drugs that they really need, despite the addiction potential is the wrong way to go. You go after pill mills, you track people that go doctor shopping for large amounts of opioids, and you really educate the public when they're receiving legitimate prescriptions for opioids that you got to be careful with these things. You can get addicted to them. But I would argue that being addicted to them is not as bad as suffering in chronic pain or severe chronic pain. So again, there's no good answer, and there never has been a good answer for the treatment of severe pain.
Dr. Bloom has written extensively on the topic and has much, much more to say. We urge you to read his entire article on our website, action.org. And while you're there, don't forget to also sign up for your daily dose of news delivered straight to your inbox. For Action News, I'm Anna Dolosky.